Now talk about another very important artery, okay, in the upper limb, and this is what is known as a suprascapular artery. Of course, when they say something is supra, is high, okay, scapular, that means it's high above the scapula. Can you see that the scapular bone is just underneath, while this artery what comes from up? So that's the basis of the name. Okay, so suprascapular artery, we said that it's a branch of the what? Thyrocervical trunk. It supplies the supraspinatus muscles and the what? Infraspinatus muscles, as well as contributing to the overall blood network that is around what? The scapula. Okay. So anatomy, so that it arises from the thyrocervical trunk. Okay, though not indicated in this picture, but we have spoken about the thyrocervical trunk. Okay, so that's just it. Okay, because it runs laterally and posteriorly across the anterior scalene muscles and the phrenic nerve, passes anterior to the brachial plexus and the subclavian artery, travels behind the clavicle towards the superior border of the scapula, crosses over what? The suprascapular ligament at the suprascapular notch. Okay, so it enters the supraspinous fossa, then it passes around the spine of the scapula into the infraspinous fossa. Okay, so it enters the supraspinous fossa. Okay, this is just, they are just trying to describe these locations. Okay, so this is still the suprascapular artery, supplying the two muscles that are around the scapula. So branches is that it gives muscular branches to the sternocleidomastoid and the subclavius muscles, supplies the supraspinatus and infraspinatus muscles, contributes to the overall blood network that is around the scapula. Okay, it will now connect it to the circumflex scapular artery, is circumflex scapular artery. Okay, the dorsal scapular artery, then the acromial branch of the thoracoacromial artery. Okay, so structures that it supplies is the infraspinatus and supraspinatus, the shoulder joint, capsule, and the scapular region. Okay, so it's very important in making up the overall blood network around the scapula. Okay, it's very also important in surgeries. Okay, it's also variable.